This patient was referred to me 2 years ago for endodontic treatment of tooth number 19. Tooth had a temporary crown on it, as you can see. According to the patient, her dentist had tried to do the root canal for her in 2 separate appointments, each appointment about 3 hours long, 2.5 to 3 hours long. And she got multiple injections, and as soon as the dentist would start trying to do the root canal, she would literally jump out of the chair. Patient says she was in tears, crying all the time, and her dentist gave her injection after injection after injection with no help. So she came to see me, and as you can see, there's a periapical lucency now associated with the tooth. You can see temporary crown, and the dentist, you can see, had endodontically accessed the tooth already. So we went over options with the patient. Patient wanted to try to save the tooth. So we went ahead and IV sedated her and did the root canal for her in 1 appointment. IV sedated her because she was already traumatized so much that she had developed dental phobia. And here's the date, as you can see, when we saw her was 2 years ago. Today is 7/1/2024, so over 2 years ago. All right, so you can again see the periapical lucency. And we did this root canal in 1 appointment for her, and take a look. So IV sedated her and did the root canal for her in 1 appointment. And take a look here. And here's the post-op, so you can see 4 canal systems, 2 mesials, 2 distals. You can see all of that anastomosis also. You can see some sealer puff here. So we did this root canal in 1 appointment, right? And there's sealer puff here. Is 1 appointment, should I have done this in multiple appointments because there was a lesion? That's one question. Should I have done this in 1 appointment, in multiple appointments versus doing it in 1 appointment? I did this root canal in 1 appointment. Should I have done it in multiple appointments because there was a lesion here? Does sealer extrusion cause endodontic failure? That's another question. And here is the date, as you can see, 2 years ago when we did this root canal for her. Well, patient came in today for a different tooth. So we always take x-rays of the teeth that we worked on previously just to make sure they're doing okay. Let me show you the 2 years post-op of the tooth, and here is the 2 years post-op of the tooth. Tooth has a crown on it now. Periapical lucency is healed. Tooth is in full function. Patient is happy. That's why she came back to see us. So 2 years post-op of tooth number 19. Again, we did the root canal in 1 appointment. Even though there was a periapical lucency there, tooth was abscessed, patient had symptoms, we still did it in 1 appointment, and as you can see, it worked. Here's the date. You can see today's date, 7/1. So you can see that 1 appointment. Root canal therapy works if you know what you're doing, of course, and sealer extrusion does not cause endodontic failure. So this is example 5,000. I've posted so many examples of one appointment root canal treatment, or 1 appointment root canal retreatment with long-term post-ops, and that show that 1 appointment works as well as multiple appointments. Some studies show that 1 appointment actually works even better, has a bit higher success rate than multiple appointments. And there you go, 2 years post-op of tooth number 19. Again, tooth has a crown on it, as you can see, in full function. So 1 appointment endodontic treatment works. Sealer extrusion does not cause endodontic failure. And again, here's the date, as you can see, today's date. So 2 years post-op of tooth number 19, 1 appointment endodontic treatment with some sealer extrusion that did not cause any issues for the patient. So here you go. Example 5,000 plus.